Sweet. So I guess my first and most important question is regarding the role of the guru in Ayurveda, because obviously in the ancient days the guru was the most important aspect of Ayurvedic education.
Yeah.
And so how do people learn nowadays, or is the guru still alive in Ayurveda?
Guru, the literal meaning, as you say, it is made up from two words, gu and ru. Guru. Guru means the one who not only guides you or gives you the knowledge of the subject, theoretical knowledge, but Guru is something who gives you, inspires you, who gives you the inspiration and maintains your interest in the subject. And Gu is basically darkness, heaviness, and Ru means to push away the darkness. So Guru is the one. It has a great importance in Ayurveda, and not only in Ayurveda, in every field. Guru is the one who tells you about the subject, who guides you, who makes you perfect. And it is very important to have Guru. And in Ayurveda, Guru-Shishya Parampara was very popular before the invent of these printing press and how to print the alphabets and numerals and everything. So before the invent of printing press, there were gurus, teachers, like ashrams. There used to be guru, and people, the pupils, they used to come to the ashram, they used to stay in the ashram, and like kings and queens or people, the children, they used to, not only kings and queens, but also the other common men, they used to send their children to the guru.
So,
like a hostel, you can compare, you can say it was like a hostel.
Okay, but I want to ask a question in there after the card goes.
Yeah.
So you're saying that Ayurveda was taught in an ashram setting in the past,
yes,
and that ashram was kind of like a healing center also?
In Ayurveda, yeah, it was like a healing center also. There were like patients also seen for practical training.
Mm-hmm.
Practical training was also given by the gurus.
Mm-hmm.
But initially when you reach to the guru, and he will ask you to stay in near to his place.
I see.
And do the service to the guru.
Because when we think about Gurukula, for example, we think about living with the guru's family or nearby, right, and really having access to the daily life of the guru's practice.
Yeah, it is called Gurukul, or the place is called Gurukul.
Mm-hmm.
Kul means the family. Mm-hmm. It's like a family, becoming the family of a guru and living like the family, near or inside his house or near to his house, so that you can reach out to Guru and Guru can tell you some works or do this, do that.
And you mentioned another great point about doing service to the teacher, to the Guru.
Yeah. It is very important service is very important to the Guru, because it is not like a forced service like or fee. Just like if we go to college and we give fee to take admission, it is not like that. It is like your own wish. The pupil or the disciple should have enough respect for the teacher, that they feel the love and respect for the teacher to do everything for him. Not like that you are just paying off the bills or like paying the fee. It's not like that. Mm-hmm. It is like you are having great respect for the teacher. You cannot, you have to be very obedient, like a obedient person. It should be from your heart, not from like, it's not restriction. It should be your passion to serve your Guru. Then only, then only the Guru will tell you, give you the Guru mantra. Do this, you will learn this, you will learn this way. Those are called Guru mantras. The secrets of success, secrets of perfection, secrets of how to be perfect in the subject. Mm-hmm. Those secrets are only cleared by or taught by Guru if he is if you are really trying to obey him or serve him from your heart.
I see.
So it is the Guru who sees everything in your character, in your lifestyle, in your habits, and then he keeps on bestowing his knowledge on you out of reciprocal love and affection. You have to make a bond with the Guru. So this was the parampara. Parampara means tradition or the culture of ancient Indian society.
So you're talking about the relationship of love with the Guru.
Yes.
The Guru is really, in a sense, giving their own personal secrets and understanding that's made their practice unique or special, right?
Yes.
So you really, as a teacher, have to trust the students to make use of that, otherwise it's a waste.
Yeah, otherwise it's a waste. In India, there is a term called patra. Patra, you know, this vessel.
A vessel.
A vessel. You put only in the right vessel, things in the right vessel. If the vessel is not right, it won't be able to hold it. So the knowledge is given to the right patra, right student. If everything is right, his character is right, his moral values are right, his way of living is right, speaking is right, everything in general, the people deserves to be a student, then he gets more knowledge. Obviously, a person who is right in righteous thinking and righteous doing, he gets the more in everything in life, more of everything.
In Ayurveda today, are there still gurus?
Yes, there are certain gurus. They are still there in India. They are living in ashrams, and but not really very much popular. They are living in forests or jungles. There are still some ashrams, and recently the government of India under Department of Ayush, they made a department called, they made an autonomous organization. It's called Rashtriya Vidyapit. And Rashtriya Vidyapit is appointing gurus also.
Oh.
People,
government gurus.
Yeah. So government approved gurus are being appointed from last few 20 years, from 1998. From 1988, this organization was formed under the government department of Ayush, and this is in New Delhi. And the gurus, there are certain conditions to be a guru, and there are certain conditions to be a disciple.
Okay.
So this is just to revive the Guru-Shishya Parampara.
So the government of India is actually stepping in to support the indigenous tradition of the transmission of knowledge.
Yes.
And which, in some senses you could say that, every government wants to support the society, so it funds certain aspects of the society that might be
very much right.
That's interesting.
Yeah.
I wonder if we would ever get to the point in the United States where we could do that.
Sure, you will be able to do it.
I could, National Public Radio will have, special grants for gurus.
No, it is very easy. In India, you can apply for being a guru. You write down to the Rashtriya Gurukul Vidyapit in Delhi and tell them that I am qualified in Ayurveda, I am MD. One has to be MD. There is one condition in Ayurveda. And second is one has to have at least 10 years of experience, personal experience of practice. And these two conditions and some recommendation by local bodies, local authorities.
When did the MD and the Western style training impact Ayurveda such that if you were a village doctor, you would not have an MD. So now they can't become gurus. I mean, let's say maybe they have 50 years of practice and no MD. Now they're...
So this government of India, that is a government body. The government body has to follow certain rules. This is what they are doing. This is their department. This is how the governments they work everywhere. They have to know theoretically that this person is having this certificate. MD is a certificate it's a government approval that this person is qualified to become a guru. But I agree with your point also that there are traditional people having even more knowledge than MDs about the herbs. They should, but they should also be given the proper chances to become national gurus in particular fields, because they are actually experts in their fields. Like someone living in forests and knowing about the herbs and using them in his day-to-day life, he can become guru in his own capacity, in his own expertise.
Mm-hmm.
So this point should be raised. This is a good point that you have told me, that even those people who are living in forests and they are having very good knowledge about herbs and other Ayurvedic branches, they should be made gurus also.
Mm-hmm.
And when we apply for being a guru, and the government gives stipend to the guru, it's like giving some monetary benefits also. If suppose I apply to become a guru, I can, and if they choose me to be a guru, and then I will be getting some remuneration also. So, and similarly, if someone wants to be a disciple or a shishya, he will apply to become a shishya.
Mm-hmm.
He will go for the test, written test, and they will conduct a test, and they will, if he qualifies, then he is told that this is a guru in this city, this is a guru in that city, in this particular branch of Ayurveda, and then the pupils are assigned to their respective gurus, and they learn practical aspects also.
But what about in the old days, when somebody wanted to study medicine, let's say 500 years ago, how?
500 years ago is not very old. We are talking about 5,000 years old.
Yeah. Well, like for
Yeah.
example, maybe
Yeah.
maybe you could say that the equivalent of the Rashtriya Vidyapeeth
Yeah.
is the kings would have court Vaidyas.
Yeah.
Right.
Right.
So then somebody coming in from that angle, they would have to be fit for being in the palace or something,
Right.
an intellectual.
This is what. Yeah. This is what I was explaining.
Mhm.
So 5,000 years ago, there were actually ashrams, and there were practical people who were using the herbs in their day-to-day lives, and they gained so much. They became so much popular and famous because of their know-how about the herbs and the use of Ayurveda, how to live, how to follow the natural lifestyle.
Mhm.
So they became popular, and people, they started coming to them and asking for helps, and also they became gurus, the teachers. Earlier, the written work was during the Vedic period, about 4,000 or 5,000 years ago, or 2000 BC. At that time, the written work was done on this Bhoj Patra,
Mhm.
the birch leaves.
Mhm.
And those birch leaves, they lasted for about few hundred years. They cannot be preserved for more than 1,000 years or something. So slowly, the literature, when the printing started, and then people, they started writing on paper.
Right.
Yeah. Earlier, the gurus, everything what the gurus taught to the children, it was in their minds,
Mhm.
not written anywhere.
And nowadays,
Yeah.
so the gurus that are appointed national gurus of Ayurveda,
Yeah.
they still remain in their ashram or in the city, but they're not professors, right? They're not academics, or can they be also academics?
They are academics.
Oh, okay.
The gurus in present times, there are only gurus which are qualified
I see.
by the government of India,
Mhm.
who are having MD degree at
Mhm.
least. So
They-
this is just a revival of guru. But the shishya also has to be educated enough and qualified for the entrance exam, and then only he is enrolled into Guru-Shishya tradition.
And does this apply to all students pursuing MD and BAMS degrees?
Yeah, this
They would
applies.
have a guru also,
No,
or can they
it is
just
not
go
a-
through?
It is not a condition. It is not compulsory.
Mhm.
Suppose I have done MD in herbal medicine, medicinal class, and suppose I apply to become a guru, and they make me a guru, and then I will be assigned students, 2, 4, 5, 10. The government will send students to me.
Oh, it's
And
not
then-
like the student is naturally attracted to the guru that they
So
admire the most. Right?
Yeah, it's like just a small effort by the government, but maybe slowly. But personal level, if you ask me personally, I have not taken the tag of Rashtriya Guru or something like that. It's like having something on your shoulder. But presently I am teaching so many students who are undergoing BMS, who are really willing to learn. Those people who are really willing to learn, those people, they become a real practitioner, the real healers, because they have passion to learn the science. Some people who just apply as a Shishya to learn as Guru-Shishya, sometimes they are not very well off, and they want to take some stipend only.
I see.
So that is why they apply.
So there's some
gurus gurus also, they are becoming gurus because they want to get some stipend from the government.
This is what I wanted to say. When you mentioned that the government gives the guru a stipend, I understand that the guru is giving a public service because they are taking a national guruship position.
Yeah.
But why would you give that guru any money? Because then it becomes immediately corrupt. Because people
in my case, I have what I have done. Personally, there are some students, some Ayurveda people who are interested in Ayurveda. They want to learn about herbs. They want to learn. So the local students who are doing BMS, they can come to me. They come over to my place and they see me doing the pulse diagnosis, how to see imbalance of Vata, Pitta, Kapha, and see the patients just sitting in front of me, and then I tell them what to see in the patient, how to talk to a patient.
Right.
Because so many things a guru can tell a disciple.
And you're talking about, is this a mentorship program or an internship?
It's not like mentor or internship. It's like a disciple, a student who really wants to learn.
I see.
There are very few Ayurvedic doctors in every city who are having good number of patients. Fortunately, in my case, in my city, I have so many patients. So there are so many people, so many students who know me by name. So they come over to my place and they want to learn. So I usually ask them to, okay, you can come over and you can sit in my clinic. It's not like I'm taking some money from them, or it's like a relationship of love and respect, as I told you.
That's awesome.
Yeah.
We need to have that here, the same challenge. It's kind of interesting to think in India, in a large city, maybe there aren't that many Ayurvedic doctors. Yeah. Well, here in the United States, it's the same situation. Yeah. And so the challenge is to find a place where Ayurveda, I think, is going to thrive, right? And if you're there in that matrix or in that vortex, then both the patients benefit and the doctors and students all benefit. Everybody benefits. I can't imagine a village where there's no Ayurveda or a city where there's no Ayurveda. But this is happening, right?
This is happening. It is very ironic that even in India, a country like India, who is having the birthplace of Ayurveda and rich tradition and culture, we have lost so many Vaidyas, the tradition basically. The Vaidyas are now slowly people are getting interested in Ayurveda from last 10 years or something. Maybe some because of the commercialization of Ayurveda, because they see so much materialism also. But there are some people, some Vaidyas also, who are having real passion for the science. They are coming up, even in India also, but not in big quantities, but not in large numbers, little bit. Some in New Delhi, in Mumbai, in Chandigarh, bigger cities. Yeah.
Well, I guess, without going into the barbarism of the British Empire and killing so many Vaidyas and destroying Ayurveda on purpose, but I guess the West is the interest in Ayurveda in the West is reflecting back and giving some encouragement now.
It is mentioned that what is actually surviving today, that means it has some fundamentally truth.
Mm-hmm.
So Ayurveda has survived since the beginning, from last so many thousands of years. It has bear the brunt of the time. So it is still able to survive. So any science which is having some fundamental rules and some truth inside, that only can survive this much time. So Ayurveda has survived till date, and now it is in booming. Now after 2000, last 15 years, it is like a big boom for Ayurveda. Everybody is interested in Ayurveda. People want to learn about it. People are talking about it, and so many Vaidyas are coming up. Even those people who did BAMS, it's a graduation, 5 years graduation course in India. They are willing to learn Ayurveda. I mean, they learned Ayurveda in their BAMS graduation 5 years degree course of Ayurveda. But during that 5 years, they learned more. Mostly, they were willing to learn this allopathy.
Well, that's an interesting point, because I guess at some point in the last 150 years or so, Ayurvedic education changed and began to incorporate more and more of the allopathic physiological concepts of the Western world. But now, also the diagnostic procedures and the value of those tests has become part of the syllabus of the curriculum of Ayurveda in the BAMS degree. So I think what I'm hearing you say is they're spending so much time trying to learn this new style of Ayurveda that they may not be learning some of the more fundamental aspects or traditional aspects.
This is what is actually in recent times, Ayurveda syllabus has become a mixture. We have to study all the allopathic things also, like physiology, anatomy, and medicine. Even medicine, we have to learn about the medicine and their pharmacology. And at the other hand, we have to study Ayurvedic principles also, Ayurvedic fundamentals. So it should be basically, particularly Ayurvedic course. People will only join Ayurveda who are having a passion for the science. Otherwise, in India, people they do BAMS and then they start practicing allopathy.
Even though it's clothed in the language of Ayurveda, some of the language.
50% they read allopathy, 50% they read Ayurveda, and they club together and they start as GP, they become GP, and they have at least like 100 patients a day, 150 patients a day, and everybody suffering from flu or cold and cough and mild ailments, and they are treating by giving allopathic medicines like antibiotics and anti-allergics, antihistaminics, painkillers, fevers. Medicine for fever, and charging them $2, $3 per patient. So they make $300 in the evening or $400 in the evening, and that's good money for them, and then they are satisfied. But nowadays, I see so many BAMS doctors who are doing allopathic practice. They want to learn Ayurveda from last 5 to 10 years. There is a change because Ayurveda becoming more popular and people are fed up from the medicines they are taking, the steroids, and recurrent again and again they are falling sick. The immunity is going down. So they want Ayurvedic consultation from the same GP they were going for their problems.
Sure, they have a relationship with that person, so that person's practice has to evolve.
So they are now coming back. So sometimes they talk to me. I see phone calls. Dr. Vikram, we know that you are practicing only Ayurveda, and we want to know this particular medicine for this. I say it is not like only medicine. It is a complete consultation. You cannot see a patient in 2 minutes or something like that. You have to be with the patient for at least 15-20 minutes or at least half an hour.
Right, it's not an assembly line situation.